Now moving on to emesis and stool assessment. Let's just say your client is vomiting or has vomited. Remember to ask about cacao, C-A-C-O. So remember, the first time your client vomits, it's going to take on the color of whatever they just ate. So if it's a Chipotle burrito, it's going to be multicolored. Or if it's a little baby that just ate a lot of peas, it'll probably be green, right? So once the client vomits, then they're going to be vomiting up all that content from the stomach. And typically it's yellow or green color, which is stomach acid. Now, a very important key term is coffee ground emesis. You're going to see that a lot on the NCLEX and nursing exams. So coffee ground emesis, you want to write this down. This is old digested blood inside the stomach area. Anytime that any vomiting looks dark in color or that coffee ground is that older digested blood. So this blood has come into contact with those gastric juices or those gastric acid, fancy words for gastric contents. Now, bright red blood is this hematemesis. Fancy words for hemat, which means blood, emesis, which means vomiting. So bright red blood that is usually newer blood. So anytime you see bright red, just think new blood or an active bleed here. Now, this is typical for esophageal varices with our clients with liver cirrhosis or some type of liver issue. So basically that esophagus gets filled up like a big huge water balloon and ends up bursting. Now the big priority here is an airway issue. So always place the client on their side with any bright red blood because that's the new blood. So for example, let's just say the client is swallowing blood from, let's say, a nosebleed, that epistaxis, because they're sitting there doing all the wrong technique, putting the back of their head up, leaning back, swallowing all that blood. The darker the color of blood just means that coffee ground emesis. The stomach is digesting or really trying to digest that blood.
Hey everyone, Nurse Mike here from SimpleNursing.com. Did you get your beautifully handcrafted study guide bundle yet? It highlights the key points and memory tricks in this video. Plus, get 900 more videos not here on YouTube, all neatly organized in the playlist, along with thousands of practice questions written by actual NCLEX writers. So don't be scared, be prepared. Try it free today. Visit SimpleNursing.com.
Now moving on to bowel habits. So you want to ask your patient about their bowel habits. And oftentimes they'll say, oh, it's good or it's normal. Well, you need to ask further. What does that mean?
Yeah, what does that mean?
What does normal mean to them? Because it can be varied between patient to patient. So you want to ask them, what does it look like? Because remember, we're always asking cacao anytime anything comes out of the body, that color, amount, consistency, odor. So what we're looking for, what would mean good bowel habits, or if you have a good bowel movement. If we're going by the textbook version of bowel movements, typically it should happen once a day. If you have really good GI health, then it would happen roughly the same time every day. The stool should be well formed, should be soft, about the consistency of soft serve ice cream. Some, especially if they have very good bowel health, will notice that it comes out in one full stool and has a little bit of a curve to an end. That would actually be a sign that you have good bowel health because you're doing a complete emptying of the bowels. However, we see variations from this. We can see variations as far as consistency, whether it's looser, firmer, and a lot of that tells us different things. Sometimes either about side effects of medications or even about their hydration or nutrition. Very important, so you'll want to pay attention to this, are the colors, because the colors can tell you a lot. So if they have black tarry stool, like you said, with the darker the color, we get concerned with contact in that GI system. So if it's black tarry stool, we get worried that it might be blood, but old blood.
So the black tarry stool, okay.
Absolutely, it could be higher in that GI tract. But there could be other reasons why they have black stool. So a few medication side effects. It could be Pepto-Bismol. So you'd want to ask, have you been taking Pepto-Bismol lately? And a big one that they like to ask about is iron supplements.
Oh, yes.
Iron supplements can cause dark stool where it wouldn't be that we're concerned about blood. It's just a side effect of the medication.
Now, iron always comes up on the NCLEX and nursing exams because they're really just testing to see if you're a safe nurse. So if you know that iron turns the stools dark black, or that black tarry stool, then you are a safe nurse. You have to educate your client that they're not bleeding out inside and going to die, right? So just know that iron, anytime you give iron, that's going to turn the stool dark black, and you have to educate your client that they're not bleeding out inside. Now moving on to bright red blood. Remember, bright red is typical of that new blood. So the big concern here is for clients with hemorrhoids. So remember, those hemorrhoids are those little bulging out of tissues inside the rectal area, basically around the butt, around the rim of the anus. So hemorrhoids, every time you strain down too much from constipation, and when you wipe, you can actually scrape it and cause that new bleeding. So hemorrhoids are caused by those varicose veins, or basically bulging out vessels inside the rectal area. And those hemorrhoids are veins that are engorged by blood, which can be easily ruptured. Now, hemorrhoids can be internal or external in that anus area. And these hemorrhoids can be itching, or clients can have the urge to scratch them when they have a bowel movement, leading to a rupture, resulting in that bright red blood on that toilet paper.
So then a key term to know is going to be melena. You're going to see this a lot. So melena specifically means that there is blood in the stool. And especially it's going to be that hidden blood, and so it's going to be higher in the GI tract. So it's not the bright red blood that we just talked about.
Okay.
If there's bright red blood that you can visually see, that's typically going to be from hemorrhoids. So it's not the hidden blood. And so this is the one that we're concerned that has been digested in some way and then coming out in the stool. So just remember, iron can turn the stool hard and black. Pepto-Bismol can also turn the stool black. And sometimes if it's black and tarry, that can be from those medications, but also that tarriness can be from a lack of water.
So what's the difference between black tarry stools and melena?
So melena means specifically that we know that it's blood in the stool. So how do we know that it's blood versus a side effect of medication? One thing is that we can do a fecal occult blood test.
Yes.
And so that's a test where we see if there's blood in the stool. Now there can be a lot of false positives, so that's why you want to do that good health history and ask them, do you take iron supplements? Have you eaten a lot of red meat lately? Have you had a nosebleed recently? And instead of, like we told you, pinching at Kisselbach's plexus, leaning forward and spitting, instead you leaned backwards and swallowed it. Or if there was any other type of swallowed blood, say from the respiratory tract, if you were coughing too much. So then we would want to make sure that we are aware of that when we do any type of fecal occult blood test.
Now for a practice question. A client presents to the healthcare clinic with reports of black stool. Oh no. The client denies the ingestion of iron supplements or even taking Pepto-Bismol. The nurse recognizes that the black stools can be an indication of what disease process. Correct answer here is a GI bleed, or gastrointestinal bleed.
So now moving on to another key color that you would want to pay attention to if it occurs in your patient. That would be if they say that they have gray, clay-colored, or pasty white stool. Now I know there can be variations of clay, like if you've ever done one of those black clay masks or a red clay,
Yeah.
That's not what we're talking about here. We're talking about one that is going to be pale in color, almost cream colored. And so that clay colored stool would result from lack of bile pigment. So that's going to mean that something's wrong with the liver. And so remember that bilirubin can often give color to that stool. It can give that brown color. So if you're not getting rid of that or excreting it in the feces and conjugating it in the way that you're supposed to, then it's staying in the body.
Oh.
And when it stays in the body, then that pigmentation shows up on your skin with jaundice. The whites of your eyes or the sclera can turn jaundice, can turn yellow. And then that stool, instead of having that color it's supposed to, it will be gray, pasty white, or sometimes the specific word they will use on test questions is they will say clay-colored stool. One thing is that in later stages of liver failure, the kidneys actually try to help their buddy out. So the kidneys will try to pick up the function that the liver's not doing, and you can get dark amber-colored urine because the kidneys are trying to pick up that function and trying to excrete and help with the process.
So it stays in the body and not on the potty.
Yes. Another thing to assess for in our patients would be frothy, floating, or foul-smelling stools. I know what you're thinking. Isn't all feces a little foul-smelling?
Yeah.
This is specific, kind of similar to how C. diff that we talked about
Oh.
in a much earlier video, how that can have a very specific, distinct smell. So with frothy, foul-smelling, or even floating stool, we're concerned about steatorrhea, where this is an issue with either breaking down fats or processing fats, or they're having a very high-fat diet. So this might be a patient who's having McDonald's every day, and likely it can indicate that they're having some type of a gallbladder issue. So they may even be having some right upper quadrant pain, and we would want to do a further investigation.
So all that fat ends up in the potty and not in the body.
Yes,
So fat from like fried foods or fat from too much animal proteins?
absolutely.
Okay. Now for another practice question. A client presents to the healthcare clinic with reports of yellow stool. Which condition should the nurse most suspect? Increased fat content is the correct answer. So remember, yellow stools suggest increased fat content or that steatorrhea or steatorrhea.